Welcome back. This is part two of the state versus Sarah Fuson in Judge David Wolfe's courtroom. This, buckle up, everybody, because this is going to be a long one. 7 parts with sentencing. So let's get started with this.
God bless the United States, this state.
Mute us, if you will. Mute us, mute the live stream, please. And what? Then we are ready for the juries. Now, are these expert witnesses that you're going to be calling now? Because the defense expert witnesses were wanting to sit in or be in on Zoom.
All right, I'll be calling 2 weeks.
All right. So you're going to call 2 fact witnesses before experts. All right. Bring the jury in. Good morning, ladies and gentlemen. Thank you for all returning for our trial. So we are ready now to continue with the state's proof.
Mr. Caleb.
Caleb, yes, ma'am.
Step right up here, please, sir. Raise your right hand and let the clerk place you under oath.
In this case, be the truth, the whole truth, nothing but the truth.
Good morning, sir. Could you please introduce yourself to the jury and spell your name?
Yes, sir. My name is Caleb. It's C-A-L-E-B, and my last name is Sherman, S-H-E-R-M-A-N.
Thank you, sir. Where are you currently employed?
I'm currently working over at Jarrett Concrete
Where were you employed in January of 2023?
at the Office of Child Safety in Nashville, Tennessee.
Is that considered DCS or Department of
Yes,
Children's
sir.
Services? Okay. Could you just give the jury an overview of what DCS does?
So in my division, we worked abuse cases where somebody was in a caretaking role with a child.
How long were you with DCS?
Approximately 7 years.
And what roles did you have while you were at DCS?
I was an investigator when I started working local cases. Those cases were abuse allegations where the parents were the perpetrators. Then went to central office, did case assignment jurisdiction, and then I went to work in the special investigations unit.
Is that also called SIU?
Yes, sir.
And what kind of cases does SIU handle?
We predominantly work cases where anybody's in a caretaking role or in a professional role with a child and there's an allegation.
So the role is different if the allegations are against someone other than the parent. Is that what you're saying?
Yes, sir.
Okay. What do you do differently? How do you handle that investigation differently, if any way?
We would still work them the same, it's just in a different capacity.
Okay. As far as DCS's ability to remove the child, obviously that's not an option if it's not the parents.
Yes, sir.
Is that what you mean?
Correct,
Okay.
yes, sir.
Okay, and yesterday, I'm sorry, let me backtrack. Just explain a little bit how a general investigation would work. What would you do on an investigation?
So typically, we would get a phone call, we would go through the child abuse hotline. From there, they use a measuring tool to decide if it meets criteria, it doesn't meet criteria. If it does not meet, it gets screened out and doesn't get picked up. If it does meet criteria, it would be assigned to me.
Okay. So yesterday during jury selection, we talked a little bit about the SIPP process. Could you explain to the jury what that is?
Yes, sir. Typically when we get a case, if there is allegations that are, we call them severe, if there's extensive bruising, it could be a sex abuse case, anything that's considered severe abuse, we would utilize SIPP.
And then who all is present for SIPP?
It'd be the CAC, their attorneys, detectives, captains. They would assist us in the case.
Chairman, would you scoot up a little bit to that microphone?
Oh, yes, sir.
or
My
drive?
apologies.
Well, that's all right.
And then at this SIPP process, is a recommendation made as to how to handle the case or what to do with the case further?
Yes, sir.
Okay. How would a, speaking generically, how would an investigation with DCS that SIU handles, how would that be concluded? What would happen?
In this particular case,
Just, or in general, yeah.
so if we did get the case and there was concerns with severe abuse, we would notify SIPP, and at that point, they would assign a law enforcement agency.
Gotcha. Okay, so let's get more specific then. Did you investigate the case in January of 2023 that involved Miss Sarah Fuson and Olivia Hyde?
Yes, sir.
Okay. How did you receive notification that you were assigned that case? Do you know?
Through the child abuse hotline.
Okay. What did you do when you first got the case?
I notified our supervisor and then to make contact with the parents.
Okay. You spoke to the parents.
Yes, sir.
What did you do after that?
I also went out to the daycare to interview the director.
Did you speak to the parents in their home,
I'm
if
sorry.
you recall?
Yes, sir.
Sorry. Did everything appear normal in the home?
Yes, sir. No concerns.
Okay. Then you went to the daycare, you said.
Yes, sir.
What did you do at the daycare?
I spoke with the director and also got pictures and a video.
Okay. We watched some video yesterday. What was the video that you saw?
It was with Ms. Fuson in the room with a child that was on a cot.
Okay. And what did you see on that video?
It looked like she,
Your Honor, I'm just asking.
Hold on a second. You objecting? The objection is for him interpreting the video because the video speaks for itself. Any other basis upon which you would want to introduce?
That's, I'll move on, Your
All right,
Honor.
I'll sustain the objection.
What did you do after viewing the video?
I notified my supervisor of what was on the video and the pictures, and that's when we determined we would need a law enforcement agency involved and notify SIPP.
Okay. And then did you contact law enforcement or how did that work?
I sent an email to Detective Pendarvis.
Okay. And did you communicate with Detective Pendarvis?
Yes, sir.
Okay. And then at that point, was your investigation pretty much concluded?
Yes, sir. Once law enforcement gets involved, we let them take the lead. When I did send that to Detective Pendarvis, he reported he worked with law enforcement and there might be a conflict of interest, so they would have to get TBI involved.
Okay.
And that was the end of my part.
And does DCS make a classification as to how did you close this case out? What were the findings that DCS made?
The findings,
Turn your microphone on, please. It's not on, so.
Oh, I'm sorry, Judge.
That's all right.
Forgive me. It's a hearsay objection. Obviously, this testimony is based on the investigation of others.
He investigated the case, Your Honor. I'm asking him how he classified he wrote the report. I'm asking him how he closed this case out. It's not-
Overrule the objection. He's basically testifying about what his investigation resulted in, so I overrule the objection.
How did you close this case out? What was your determination?
we substantiated.
What does that mean?
So with ours, we don't do the criminal side. So with a substantiation, it would keep her from working with children, daycare, or schools.
And then that would go into a database?
Yes, sir.
And you say her, you mean Mrs. Sarah Fuson?
Yes, sir.
If I could have one moment, please, Your Honor.
You may.
Further questions?
All right. Mr. Strains, you would wish to cross-examine?
Just very briefly, Your Honor. Good morning, Mr. Sherman.
Morning, sir. How are you?
Good. Do you remember the date that you were brought into the case?
No, sir.
Okay. And you received, I think you told the jury, a call to the hotline at DHS,
DCS.
DCS?
Yes, sir.
Okay. Do you remember when you received the call?
No, sir.
And do you remember who called you?
No, sir.
Okay. Did there come a point in time early in the investigation that you heard that there was an allegation of a skull fracture?
Yes, sir.
And who did you hear that from?
I believe it was Dr. Lakin or our safety nurse, Thomas Spiller.
And how long were you investigating the case?
I don't recall unless I have my papers in front of me.
Did you appear before the Davidson County Grand Jury
No, sir.
and testify?
No, sir.
I should have said the Montgomery County Grand Jury.
No, sir.
You did not. And you had no role in selecting the charges that went into the indictment.
No, sir.
That's all.
Redirect. Thank you, sir. You may step down. You may have a seat in the courtroom, or you may leave if you'd like.
Yes, sir. Thank you.
Mr. Holder, you may call your next witness. Around here, raise your right hand. Let the clerk place you under oath.
I do.
Good morning, sir. Could you please introduce yourself to the jury and spell your name?
I'm Detective Allen Pendarvis, ALLENPENDARVIS.
Thank you, sir. And where are you a detective?
I'm employed with the Clarksville Police Department.
How long have you been employed with the Clarksville Police Department?
A little more than 16 years, I believe.
And how long in your current role as a detective?
I've been with the Special Victims Unit for right at 10 years.
And what sort of cases does the Special Victims Unit investigate?
A variety of crimes, typically child abuse, child sex abuse cases with adults, human trafficking, child exploitation, things of the sort.
If you recall offhand, how many child abuse cases have you investigated?
I'd say a good average, some more than less, a year, maybe 1,000 in my 10 years that I've been there.
Okay. And you were working in this role in January of 2023, is that correct?
Yes, sir, I was.
Okay. Did you receive a call from DCS about a case involving Sarah Fuson and the victim, Olivia Hyde?
Yes, sir. I'd initially received an email from
Okay.
Mr. Sherman.
Okay. And what did you do upon receiving that email?
He had sent me the email, had a very brief synopsis about what all he had done, and it included a few photographs and a couple videos from the child care center. So after reviewing those photos and videos, it was also described the relationship of the potential suspect with the sheriff with Montgomery County. So,
I'm sorry, when you say potential suspect, are you talking about Sarah Fuson?
yes, sir, I am.
Okay. And what do you mean by the relationship?
In that email, it had described that she was the daughter of the sheriff.
Okay. And what did you do as a result of learning that? Anything?
Yeah, after watching the videos, I went and consulted with my supervisor to talk about the possibilities of there being a conflict of interest in the case. She had then consulted with her chain of command, which ultimately ended up with a request at the district attorney's office to submit a request to TBI for them to investigate the case.
And why did you feel, I'm sorry if maybe you already explained this a little bit, but why did you feel the need after watching the video to go consult with your supervisor?
The videos were quite shocking at best. I've worked several of these, and after watching the videos, I was fairly confident that if we had worked the case ourselves, there was a good chance that charges would pursue after watching those videos.
If Miss Fuson was not the daughter of the sheriff, what would you have done differently?
Still would have worked the case and still would have pursued charges just based on that initial.
But you would have not gone to your supervisor?
I mean, I consult with my supervisor
Okay.
quite often so she's in the loop of what we're tracking as well.
So to avoid any potential conflict, you wanted to make sure we had a neutral third party?
Correct.
Okay. And did you just cease all your
Yes, sir.
investigation?
I believe I got that email from Mr. Sherman around 3 p.m. that afternoon. By the time that the word had made it up to our chain of command and the district attorney, I was advised at about 5:15 that a request had been made to TBI and not to do any additional tasks until we got 100% word from them that somebody was going to be taking the case over.
So you had the case for one day?
I had the case for a couple hours.
Couple hours.
Yes, sir, between 3 p.m. and about 5:30 p.m. Just about the only additional tasks that I did in that case during that time is after watching the videos, I did call Mr. Sherman to ask if the child had received a medical from any staff. He had informed me that the mom of the child was a nurse, but he had returned the phone call just shortly after my initial phone call with him and said that they had scheduled a meeting with Vanderbilt the following day.
Okay. So you did that out of an abundance of caution based upon what you saw in the video?
Yes, sir.
Okay. I have no further questions for this witness at this time, Your Honor.
Stranger, you wish to cross-examine?
Yes, Your Honor, just very briefly. Morning, Officer Pendarvis.
Good morning, sir.
I think you were brought into the case January the 18th of 2023, is that right?
You're correct, sir.
And it was referral from Caleb Sherman, who worked for the Department of Children's Services, is that right?
That's right.
And you were in contact also with Jonathan McGowan at TBI, is that right?
The following day, yes, sir.
Okay. And it was Investigator Sherman with the Department of Children's Services that suggested to you that there had been a finding of a hairline skull fracture, is that right?
Yes, sir. He had called me the afternoon of the 18th the morning of the 19th. I told him the 18th that, hey, I'm probably not going to be working this. It sounds like TBI has been requested. So he had called me the morning of the 19th to give me news that Vanderbilt had potentially found a hairline fracture, and he was asking who the agent in charge that he needed to report this information to.
But you didn't see any written report
No, sir.
that corroborated that in any way, is that right?
That's correct.
And that's what motivated you to pick up the phone and contact the parents of Olivia Hyde, is that right?
I don't recall contacting any parents of Miss Hyde.
Aren't you the individual that suggested that Olivia should be brought to Monroe Carroll Hospital at Vanderbilt for?
I did suggest to Mr. Sherman to set up an appointment for her. Yes, sir.
Okay. And that was based on sort of this circular discussion of Sherman telling you that he had heard that there might be a skull fracture?
Me contacting him and asking for the medical?
No, you making the suggestion to Mr. and Mrs. Hyde that they have the child brought to Monroe Carroll.
I don't recall ever speaking to Mr. and Mrs. Hyde. I'm not saying I didn't, but I don't recall that.
Who is it that would have suggested that they go to Vanderbilt Hospital?
I suggested to Mr. Sherman after watching the videos that the child be checked out.
But you never saw any sort of a medical report, a CT scan, anything that conclusively stated that this child had suffered a skull fracture?
No, sir. By the time Mr. Sherman called me and informed me of what he had been told, I told him I was no longer going to be working the case, that Agent McGowan had contacted me, and I gave him that contact information to provide that info to.
Thank you.
Yes, sir.
Redirect. Thank you, Detective. You may step down. You're free to go. Holder, you may call your next witness.
State calls Dr. Karen Lakin.
You'll raise your right hand, doctor.
In this case, be the truth, the whole truth, nothing but
Good morning, ma'am. Could you please introduce yourself to the jury and spell your name?
Yes, I'm Karen Lakin, and it's Karenlakin.
Thank you, ma'am. I'm going to pass up. Can you tell the jury as I'm passing this up, what is your profession?
Your Honor, may we approach one moment?
You may. And there's other experts that are going to testify. The rules allow experts, other experts, to also sit in on the testimony of one expert. Anyway, it's a rule that we allow. And one of those experts that's going to be testifying later in the case is going to be on Zoom, but they won't be shown, but they want to be able to listen to the testimony. And that way they can formulate opinions and so forth. So we're going to ask you to step across the way until that expert is in on our Zoom meeting, and then we'll go from there. Doctor, if you want to step down and have a seat in the audience.
Okay.
As soon as this individual is in our meeting, then we'll resume with court, but in the meantime, I'll step off until that time, so. Oh, can we, yeah. Is that? Yeah, I'm just trying to figure out if we need to. Do you need to talk to your client again? We have, in the middle of this morning before we started, we took care of a couple of criminal matters. I've got another one that we've set at 8:30 this morning, but we're now going to be taking care of it sometime this morning during a break. So just bear with us. I'll step off until such time as we have our experts lined up. Thank you, ladies and gentlemen, for your patience, and we've disposed of a matter in your absence unrelated to this case. So we are now ready to recall the state's witness. So, Doctor, if you'll come back up. I believe you already sworn in, correct? You were previously sworn, placed under oath, so I would remind you that. You were, I think, about to talk
Yes, Your
about
Honor.
her CV.
Yes, Your Honor. Well, I'm going to start over if that's okay. Could you please introduce yourself to the jury?
Yes, I'm Karen Lakin, and it's Karenlakin.
Thank you. And could you please tell the jury what your profession is?
Yes, I am Associate Professor of Clinical Pediatrics at Vanderbilt University Medical Center. Actually, I'm supposed to say Monroe Carroll Jr. Children's Hospital at Vanderbilt.
Okay.
And I'm also the section head for the child maltreatment program and the medical director for what we call the care team, which is the consultative team at Vanderbilt whenever children come in with traumatic injuries.
Okay. How long have you been a pediatrician?
I've been a pediatrician now for 29 years.
29 years.
Yeah.
Do you specialize in a particular field of pediatrics?
Yes.
And what is that?
Child maltreatment. We actually call it child abuse pediatrics is the official terminology.
Okay. How long has this been your area of expertise?
I've actually practiced in the field for the past 24 years now. First as a consultant, and then I developed the CARES team at Le Bonheur Children's Hospital in Memphis, Tennessee. So I became the medical director there in 2006.
Could you please describe your educational background?
Sure. My undergraduate degree is from Duke University, and I have a master's degree in public health from the University of North Carolina, Chapel Hill. And my medical degree is from East Carolina University in Greenville, North Carolina. My residency was at Le Bonheur Children's Hospital in Memphis and the University of Tennessee.
And could you please summarize any postgraduate work as a pediatrician prior to your current position?
I was a general pediatrician with the Raleigh Group in Memphis, Tennessee, for 3 years. And then I joined the faculty at the University of Tennessee as a general pediatrician in the Department of General Pediatrics. And then I started working in the field of child abuse pediatrics.
Have you previously been qualified as an expert in the field of child physical abuse?
Yes, I have.
Do you know how many times?
Over 100 times. Yeah.
How many counties, if you recall?
Most of West Tennessee, about half of Middle Tennessee, a few counties in East Tennessee, and then also in about 6 additional states.
And have you previously been qualified as an expert in Montgomery County, Tennessee?
I have.
How about Dixon County, Tennessee?
I believe I have also in Dixon, yes. Yes.
And as, Your Honor, at this time, I would offer Dr. Karen Lakin as an expert in the field of child abuse
Any
pediatrics.
questions?
All right, I just had a few questions.
All right. In qualifying an expert, both sides get to ask questions before the court makes a determination regarding the qualifications. Mr. Trines, you may question the witness.
Morning, Dr. Lakin.
Hi.
Your report that you prepared in this case indicates that you've been declared an expert in a number of states. Is that right?
That's correct.
And one of those states is the state of Mississippi. Is that correct?
That's correct.
And do you recall testifying in a case styled State v. Joshua Clark
I do.
back in 2018?
Yes.
And that would have been a case that involved an allegation of shaken baby syndrome.
That's
Is
correct.
that right? Back
Yes.
when that was really a big topic in child abuse. Is that correct?
It's actually still a very prominent topic in child abuse.
And there was a conviction in that case. Is that right?
Yes,
And it was based in large part on your testimony. Is that correct?
that's correct.
And if you recall, the Mississippi Court of Appeals found that your testimony in that case was so unreliable as to be inadmissible.
That's not my understanding of the finding.
Now, it was later changed by the Mississippi Supreme Court. The Intermediate Appellate Court did find your testimony unreliable.
No, that wasn't, it was actually whether or not the judge, my understanding is whether or not the judge should have allowed my testimony. So I wouldn't say that that was the,
Well, that's what the Mississippi Supreme Court said.
yeah, right.
But what the intermediate appellate court said was that your testimony was unreliable. Remember that?
And again, I'm not a lawyer or a judge, so my understanding is that all of that transpired through the courts, but ultimately it didn't change anything.
That would have been a pretty significant finding against your testimony.
If it had been upheld, it would have been, but it wasn't upheld.
That was made by the intermediate court.
Correct, but it wasn't upheld, so
And it's only a few years ago, correct?
that would be 7 years ago.
And you never read the opinion of the intermediate?
I read parts of it, but it's so much legal terminology and that it was,
You remember seeing the word unreliable,
I'm sure it was in there,
and you remember that the case was initially reversed.
but it was not upheld. It was then not upheld.
And I fully acknowledge that.
Yeah.
I'm just making the point that you
I would not state that that's actually ultimately what that finding was. I don't agree.
Now, that's my question.
You may.
Your Honor, based on
Hold on, make sure that door is closed.
Based on the ruling, and I've got a copy for the court if you need it, if the case is State v. Joshua Clark, it is a Mississippi case. The intermediate appellate court in Mississippi reversed the conviction based on the unreliability of Dr. Lakin's testimony. The court has permitted me to conduct a voir dire of her here in open court in front of the jury. I think that finding by the Mississippi Intermediate Appellate Court casts some doubt on her qualifications to appear as an expert in this court. And I think it affects her credibility in the sense that the Intermediate Appellate Court found that her testimony to be so unreliable as to be inadmissible. Based on that, for the record, I'm asking that the court not declare her to be an expert in this case.
Holder, you wish to respond? Mr. Moore?
Briefly, obviously, as the court knows, the intermediate appellate opinion reversed by a Supreme Court is for nothing legally other than, obviously, you'd be entitled to say, isn't it true that intermediate court said such and such? Fine, he's done that, which I submit is more akin to a question to be asked on cross-examination, has nothing to do with her qualifications to be admitted as an expert. That would go, if anything, to the weight of her testimony, not to her credentials.
First of all, we are not in the state of Mississippi, and I don't credit the the Intermediate Court of Appeals in Mississippi's opinion as to whether or not, for two reasons. One, we ain't in Mississippi. Two, is the fact that we are not dealing with a shaken infant syndrome. I have had experience in that type of a case as a trial lawyer representing someone who was charged with that same type of an offense. So I'm well familiar with the shaken infant syndrome and the ever evolving diagnosis and treatment of those types of injuries. But I can tell you that because this is not a shaken infant syndrome case per se, or at least it's not to my knowledge, then we are not dealing with that particular thing. But I also agree with Mr. Moore that the questions that have been raised don't go to her qualifications as an expert witness. They might go to the weight to be given to her. And frankly, I probably should have had the jury step out before this voir dire of the expert witness occurred anyway. So I'm going to bring the jury back in, and I'm going to qualify this lady as an expert in the field of child abuse pediatrics. Is that the area of her expertise?
Yes, sir.
And I'll instruct the jury that they are to disregard any questions regarding her qualifications that were raised by some issue regarding the state of Mississippi, and that as far as this court is concerned in the state of Tennessee, she's qualified as an expert. That any evidence regarding those other issues could be considered by them as to the weight to be assigned to that testimony rather than her admissibility of her opinions.
Thank you.
All right, bring the jury in. Ladies and gentlemen, in your absence, I considered an issue and an argument of counsel regarding the qualifications of this witness. As I instructed you in my initial instructions, it is my responsibility to apply the law that the state of Tennessee allows in this situation. This issue that was raised regarding the doctor's testimony in a case in Mississippi, in this court's opinion, do not affect her qualifications as an expert in the state of Tennessee. I have considered the argument, and I am ruling and ordering that this witness be considered to be an expert and qualified as an expert in the field of child abuse pediatrics for the state of Tennessee. The issue that was raised regarding her opinion in a different case outside of the state of Tennessee may, if it's raised again, may be considered by you as to the weight to be given her testimony and whether or not it is to be, how much weight to assign to her testimony. But it doesn't affect her qualifications as an expert in this field, and I am therefore instructing you that she is qualified as an expert in the field of child abuse pediatrics. Now, I don't know if your counsel will approach the bench, please. To the lawyers, trying to avoid you having to walk. I know you like the exercise you get from walking across the hallway, but I'm trying to avoid that as much as possible. So rather than trot you out across the hallway and then trot you back in, I showed this to the lawyers, and everybody agrees it's a permissible question to be asked, so I'm going to allow one of the lawyers to ask that question.
Yes, Your Honor. Thank you. The question was, how many times have you been called as a witness in other cases?
As an expert witness in other cases, all of it's, I don't count anymore. I've been doing this since essentially 2000, so the past 25 years. And I testify as an expert witness in juvenile court, probably, I'm now averaging about 20 a year. And then for criminal cases, I've probably testified as an expert witness maybe over 40 times now. For both, I've also reviewed cases for the defense, and I've done a handful for the defense, but the majority, because of my job, is I'm usually requested for assistance because of the patients that I see.
And if there were any other issues, like Mr. Strantz brought up, I'm sure he would have brought them up. Was that the only other issue regarding your testimony and all the times that you've testified that you're aware of?
Yes, and I mean, I've never not been allowed to testify as an expert.
I'm going to pass up something. Do you recognize that?
Yes,
And what is that?
this is my CV.
Okay. Just lists your work background, educational background, and et cetera.
Yes,
Basically what you've already testified to.
yes.
Your Honor, I would offer that as the next number to exhibit.
What are we up to? 4, Exhibit 4.
All right, Dr. Lakin, in your years of experience, have you worked specifically with skull fractures before?
Yes.
Okay. Now, can you describe, in any child physical abuse case that you treat or review, can you describe the process of how you determine if abuse occurred?
Yes, so just like with any type of medical condition, you have to start out with a history. So a patient comes in and you take a history as to what has happened, what are the symptoms, just like you do for any medical condition. Because I'm a pediatrician, then I have to take history from the caregivers that present with the patient. I review any medical testing that's been done up to that point, and then I may also recommend additional testing. I may be talking to other doctors that have seen, because I'm a consultant, and they've already seen the first treating physician. So I may also discuss with them any type of concerns that they have or findings that they have as I'm going in as well to see the patient for myself. And then based on any tests that I review, also if there's radiological studies, I'm going to review all the radiological studies as well. In particular, because in my field, we always have a lot of radiological studies, then I will go and speak with the radiologist and review those films with the radiologist as well. Any other subspecialists that might be involved, neurosurgeons, orthopedic surgeons, infectious disease, just whoever else is involved. And then based on all of that information, then I'm going to develop my recommendations, my assessment recommendations.
Thank you. And then in your role as the head of the care team, could you just explain what it is the care team does exactly?
Yes, so we're a consultative service at the hospital. We are not the ones that see the children initially if they're coming in through the emergency department. So any children that come into the Vanderbilt Emergency Department that have any type of traumatic injuries that might be concerning for non-accidental trauma, but also we'll see children that have complex medical conditions where they might be presenting like with what we call failure to thrive. They don't grow well. We have a failure to thrive clinic. They will consult us to help assist if they want some additional input, because we also serve as the primary sort of liaison to communicate those medical findings to the outside agencies that might involve, such as Child Protective Services or law enforcement, because someone has to explain to them what the injuries are and everything. So that's our role. And then we do, our team has a clinic, and so children are sometimes referred to us by other pediatricians that have concerns. We may get children that are seen out in the field by Child Protective Services or law enforcement. They can refer children to us as well. And in that situation, we'll see them on an outpatient basis as the first provider that does the examination.
So when the care team gets a case, if I'm misstating this, please correct me, abuse has already been suspected by someone at that point. Is that accurate?
For the most part, except for those situations where we have the complex medical kids. So with complex medical kids, it's not necessarily that the question is coming up whether it's non-accidental trauma. It is because of their complex medical conditions that the families may need extra help or not growing or things like that. So that's also a portion of our practice.
Okay. And even so, some of the cases that you review, your determination would be that it's the result of an accident and not abuse. Is that accurate?
Oh, of course, yes.
And what do you base that on?
Again, we look at whether the history is going to support the type of findings that we see, the medical findings that we see. If there are other additional injuries that we find, such as occult fractures, healing fractures, or other injuries that the presenting issue that came in was not remotely associated. So then the question is where are these injuries coming from that, we didn't get a history for?
If there's other evidence outside of a description of what occurred, such as video or something, would that be important to consider as well?
Yes.
Now, are you familiar with Olivia Hyde?
Yes.
And were you asked to consult or review that case?
Yes.
Okay. Could you please describe the process and assessment you made regarding how you evaluated that case?
Yes. So I actually was not called to see Olivia when she came to our emergency department because she was actually referred from, I believe, law enforcement to have another evaluation done because of the findings that were on a video that was provided to law enforcement by the daycare center. So she was originally seen by her primary care provider, who did a physical exam shortly after the incident. I think the incident occurred January the 9th, and then she was seen by the primary care provider on the 13th. And so at that time, some external injuries were noted and documented. And I believe they checked a blood count or hematocrit just to see what her hematocrit level was, red blood cell count. But there weren't any types of studies that were done to look for any internal injuries. And so after the detective had seen the video and saw the extent, then she went to the emergency department for further, more detailed studies, x-rays and CT scans. Our team was not consulted at that time when she came to Vanderbilt because it was the video was already known and reported. And so they did those studies and then reported back to the caseworker what the findings were. And it was only after that process then I was asked to review all of that. So my evaluation included reviewing the videotapes. There were 2 videotapes, looking at all of the medical records. And I actually reviewed all of Olivia's medical records because she was only 13 months old. And so I had all of her primary care records as well as her visits to the emergency department. And then I reviewed all of her lab work that was done at our hospital, the CT scan, the skeletal survey.
Thank you. And can you describe your assessment that you made about Olivia's injuries in this case?
Sure. So actually the first thing I was able to review were the records. And so in the emergency department records and the findings, as well as looking at the CT scan of the head and the skeletal survey, there were injuries noted on her CT scan of a area on her, just to the left of her sagittal suture of a possible fracture. The area was described as a lucency that was suspicious for fracture. She also had a small abrasion scratch towards the inner surface of her left eye. And that was noted on her physical exam in the records. She did not have any skeletal fractures. and on her physical exam, and the visit to the emergency department was not done until the 19th, so that's 10 days after the incident. And she still had documented some fading bruising that were on both of her arms in the emergency department at that time.
Thank you, ma'am. I'm going to pass forward. We're going to flesh out more of what you just testified to, but I want to do you recognize that?
Yes.
What are those?
These are the medical records for Olivia.
Are those the medical records for her visit that you described on the 19th, I believe?
Correct, yes.
Your Honor, I would ask that those be admitted as the next numbered exhibit.
Right, next exhibit in order would be 5.
If you could keep those with her, please. What's their number? And Doctor, if I could direct your attention to page 46, bottom. Where it says findings, do you see that?
Yes.
Could you please read that?
Yes. No intracranial mass effect or midline shift, normal parenchymal attenuation, no evidence of intracranial hemorrhage or evolved infarct, no extraaxial fluid collection, normal size and configuration of the ventricles, linear lucency left of the sagittal suture, extending to the coronal suture, no overlying soft tissue or underlying intracranial abnormality, normal scalp soft tissues, opacification of the maxillary sinus, the mastoid air cells and middle ear spaces are clear, unremarkable orbital contents. The impression is no acute intracranial process. Number 2, thin linear lucency just to the left of the sagittal suture, extending to the coronal suture, suspicious for age indeterminate, though likely subacute to chronic fracture. No soft tissue swelling or intracranial abnormality is seen adjacent to this lesion.
Okay. Can you please explain that to normal people? What does that mean that
Yes.
you just read to us?
So again, the CT scan was performed to evaluate for any type of injury that you can't see externally on a child. We are always very concerned if there's a history of head trauma to make sure that there's no injury to the brain itself, intracranial hemorrhage, subdural hemorrhages, those things that we can see in abusive head trauma. There was an abnormal finding, which is this thin linear lucency that was described, that was extending from the coronal suture. The radiologist described this as suspicious for age indeterminate, though likely subacute to chronic fracture. So there was an abnormal finding on the CT scan that was linear. It's described as linear, and when you see the fracture, you can tell it's very linear. It's not what we call the serpiginous or wavy. It is parallel to the sagittal suture. So in a baby's skull, you have 4 to 5 major sutures between the different bones of the skull. And this was to the left and parallel to the sagittal suture. The lucency was suspicious for fracture because fractures are linear on scans. They're not serpiginous.
Let me ask you to clarify that. The terminology that the radiologist used, suspicious for fracture,
Yes.
would he have seen the video at this point?
Oh, no.
Would that have helped him make his diagnosis of the CT scan?
Yes, so the radiologists will tell you all the time that the only thing that they have for interpretation is what is given to them when they're reading the films. And so that comes from the emergency department. And no one in the emergency department saw any video. They were just told that there was a video of a child being injured, and they needed to examine the child to see if there were any internal injuries. So the more information that can be provided, the better their interpretation is.
Thank you. And we've been talking a lot about sutures and skulls and whatnot. I'm going to pass you an item so we can let the jury
understand what you're talking about a little more clearly.
Do you recognize that?
Yes, this is what we call the 3D reconstruction on the CT scan of Olivia's skull.
Is that a still image of the 3D?
Yes.
Okay. Does it appear to be accurate? Has it been altered or
Oh, no,
edited in any way?
no.
You know, I would offer that as the next numbered exhibit and ask to publish it to the jury.
No objection.
Six.
Now, I asked to get a laser pointer charged over here. Let me see if it's working.
Okay.
You may. The lights.
Could you please, with the pointer there, describe what you were talking about with sutures and linear lucencies and whatnot?
You may need to step around, doctor, if it's not cooperating with you.
You can use my microphone if you like, so the jury can hear you.
Okay, now we can see it. So I was talking about the 4 to 5 really large sutures that you have normally in a baby this age at 13 months of age. And these are the one of the major ones, which is the coronal suture. And then this one that's going perpendicular, this is the sagittal suture. So those are supposed to be there. Those are not fractures. We know they're supposed to be there. This is the anterior fontanelle that you can see right here. And everybody knows that is the soft spot, so that's just where those bones are coming together, but it's not completely closed. And then just to the left of the sagittal suture, there is and the reason why the radiologist described it as linear is because it's very straight. There is this crack right here, and it goes from the coronal suture, but it's parallel to the sagittal suture, and it's very linear. Oh no, is there a way to blow that up?
They're saying, sorry, laser pointer's not showing up very well. I'm gonna come up.
We have a rule. We got a yardstick. Let's get. Modern technology fails us all the time, so we'll resort to the old school methods. We'll have a pointer. I think it's the lightness of that. Let's turn that thing off before we poke somebody's eye out with this.
Sorry.
There we go.
Speak up. There's no microphone. I apologize. They're going to hand you a microphone, doctor.
I need to start over again?
Please.
Okay. This is the coronal suture. So again, those 4 to 5 very large sutures that you see in babies. Excuse me. This is the sagittal suture. This is the coronal suture. This is the anterior fontanelle, or the baby's soft spot. And then you can see how squiggly these are and how squiggly these are. And that's the characteristics of these normally occurring sutures. This is a very linear, which is why it's described as linear or crack. reaches here to the coronal suture. It doesn't terminate anywhere else. That's the end of it. And that's the area that the radiologist described as the linear lucency that was suspicious for fracture.
Thank you. And if you could just stay there, because I'm going to next play the actual 3D rendering, so you can identify that as well. Give me one chance to. That pulled up. And is this basically the actual 3D image of the still that we just looked at? Is that what this is? Dr. Lakin?
Yes.
That I'm getting ready to pull up?
Yes.
Do you recognize that? From the records that you reviewed?
Yes, I think. Yes.
Your Honor, I would like to offer this as the next numbered exhibit, the actual 3D image of the CT scan.
Is it going to be on a thumb drive?
Yes.
It'll be 7.
So is that basically the same thing that we were
Same one.
looking at?
Yes,
Okay.
right here.
Now, you can sit down, I'm sorry.
Okay.
Thank you so much. So while you were reviewing the CT scan, here's the thumb drive, by the way. For the clerk to mark. Did you consider any other possibilities for that linear lucency? Is there anything else that it could have been?
Yes, so we sometimes will see what we call accessory sutures that can be found on the skull as well. The accessory sutures, again, we describe them as sutures. They're just normal variants that you can sometimes see. And that would be a very unusual location because they're typically seen on the parietal or the occipital bone. And
I'm sorry, I'm going to pull that so you can show us what the parietal bone is where.
so that's in the bigger flat surface on either side. And the occiput or the occipital bone is in the back. And you have the lambdoid suture, which is the sutures that join the parietal bones and the occipital bone. That is the area where we typically will see the accessory sutures.
So is this line that we were talking about that you pointed out, is that in a normal area that you would see an accessory suture?
It's not the typical one. And we also will more often than not see what we call bilateral, so on either side, as opposed to just one isolated.
So other than that, what else differentiates that from either what you would call a, quote, Wormian bone or accessory suture? What differentiates what you're seeing there from a Wormian bone?
So a Wormian bone is actually what we call an intrasutural accessory bone. So it will oftentimes be within the suture itself, and they are typically, they look like bone fragments as opposed to an accessory suture, which is, again, it's not connecting. That's why accessory sutures can sometimes be mistaken for fractures. Wormian bones are, they look like fragments of bones. And Wormian bones are considered also can be associated with other medical conditions, such as probably the most common one people hear about are bone conditions called osteogenesis imperfecta. But Wormian bones can also be seen in just the normal general pediatric population. This is, again, not a typical area where you would see a Wormian bone. It would be incredibly unusual to see one at the coronal and the sagittal, where the coronal and the sagittal come together. The other distinction that I made, and the radiologist that reviewed this, Dr. Martin, with me, that linear appearance, again, is very straight and not irregular. So that also is not characteristic of a Wormian bone. Also, there is no continuation of that crack with the sagittal suture. So it's parallel to it. And then it does reach where the coronal suture is, which that's what we typically see with fractures. It's that weak area where it comes together with the suture itself. So a Wormian bone, again, looks more like a bone fragment and has a continuation. When you do 3D reconstruction, you oftentimes get what we call noise around on what looks like the surface of the bone. So you can see little wavy areas on the bone, but the actual findings are very clear in terms of you can see the very clear sutures and you can see the very clear crack.
Thank you. We've been talking a lot about Wormian bones and accessory sutures. Did you, as part of your preparation for your testimony today, did you prepare some examples of Wormian bones?
Yes.
Did you provide those to me earlier today?
Yes.
Is that what we're looking at here? Is this the images that you prepared for us?
Yes.
Could you please describe what we're looking at here? To be clear, this is not Olivia's.
No, these were just the examples when I was explaining to Mr. Holder the differences between Wormian bones and sutures and fractures. So this is just, again, a 3D reconstruction of a baby's skull, which shows the sutures, and it just outlines the different sutures that I just described as well. So the lambdoid suture is where the parietal bones and the occipital bone come together, and then the posterior fontanelle, or the soft spot in the back, and then that's a picture of the sagittal suture.
And I apologize, but I'm going to ask you to get up again
Yeah.
so that we can.
So as I just mentioned before, this is the parietal bone on either side. The sagittal suture separates those two. This is the lambdoid suture, which separates the parietal bone from the occipital bone. And of course, it's also on this side. That noise that I was talking about that sometimes happens with 3D reconstruction is not, you can see like these little spots here. You can even see a fairly prominent one here. Again, this is a computerized 3D reconstruction, so when the computer is developing these, you can sometimes get some background noise.
I'm going to go on to the next slide. If you could please describe what's in the next slide.
So this is an example of a true Wormian bone, and you can see how it looks like a fragment as opposed to anything that's parallel or linear, and it has very squiggly outline, just like the sutures do. And then, again, the sagittal suture is right here, but these are called Wormian bones.
Is this, and again, this is not Olivia's skull, is this?
No, this is not.
Is this, I'm sorry, is this from the front or the back?
This is the back.
the
This
back.
is the occipital bone,
Okay.
and this is the parietal bones.
Gotcha. I'm going to go to the next slide. What are we looking at here?
So this is the only Wormian bone representation I could find in my literature search to show an actual one that was associated with the coronal suture and the anterior. Would have been where the anterior fontanelle was, but there was a Wormian bone, or what they call an intrasutural bone, that was present. And it's right here. And again, as you can see, this is not parallel to the sagittal suture. It is a fragment. It looks like a bone fragment. So it's not linear.
Thank you, doctor. And then the last slide is, again, this is Olivia's image.
Right, this is the same image that we showed before. So here's her anterior fontanelle, and here is the very linear crack.
Okay, thank you. And as you're taking your seat, I'll ask you, my understanding is that this fracture did not show up on a normal x-ray. Is that accurate? And is that normal for?
Yes,
Is that why you do a 3D image?
correct, or CT scan. If you think about it, the regular plain films or x-rays are just two-dimensional, but the CT scan is three-dimensional. It goes all the way around and formulates those images.
So just to reiterate, what is your expert opinion as to what Olivia, that linear lucency, what is that we're looking at?
In my opinion, it's a fracture.
Now, when you were reviewing Olivia's records, I know you said you reviewed photos and videos, is that right?
That's correct.
And did you review those again this morning?
I did.
I'm going to play the first clip that, we watched the entire video yesterday. We're not going to do that. I'm going to play just a clip of, while Olivia was in the high chair, that we just zoomed in a little bit so that you can see. Do you recall that video?
Yes.
Okay. Now, what you saw there in your expert opinion as an expert in child abuse pediatrics, is that consistent with some bruising that you would have seen on her arms?
Yes. And may have seen some in her abdomen if she'd been seen earlier, but.
I'm going to just let this play out. It's only got 30 seconds left or so, 40 seconds. You said you previously saw the bruise photographs as well, correct?
Yes.
I'm going to pull those up again. So based upon that video and then these photographs, what are we seeing here in these photographs?
So you can see those oval-shaped bruises that are, I think there's 3 down towards the bottom, and then a little bit, it's more linear up at the top. And so those would not obviously be in an area that she would normally fall, like what I call childhood bruises, or typically more anterior, where they're walking and they fall forward. These are actually what we call multiplanar because they're in the back, but they also circle around. And that would be consistent with where she was grabbed and shoved into the chair.
I'm going to have 6 photos. I'm going to move along and just, if you could just describe the bruising.
Yeah, again, you can see that those oval, a few of the oval and then linear areas up at the top. And again, that wrap around her arm.
And the next one, is that similar?
That's the same one, yeah.
And that's on the back of her arm, isn't it?
Correct.
Okay. And then this one, it's like you can see some sort of waffle pattern on there.
Yes.
What would that be from?
It's something pattern, so anytime we see a pattern injury, then we are very concerned about inflicted injury. So I believe like around that area, she had some sleeves, and the fabric on it may have been pushed into it.
Okay, doctor, so after you reviewed the video and you reviewed these photographs, what determination would you make as to what sort of, was this accidental trauma, or what would you classify this as?
No, this was non-accidental trauma or inflicted trauma. And it's consistent with blunt force trauma.
Thank you. I'm going to show another clip now that we watched yesterday. Again, it's just zoomed in and edited for time purposes. This is of the nap time. Do you recall watching the nap time segment as well?
Yes.
Normal for a 1-year-old to push themselves up and not go right to sleep like that?
Yes.
I'm going to pause it there for a second. Could you please describe what you saw in that 45-second clip there?
Yeah, so Olivia is being forced down on that little cot multiple times. I think I counted 8 times where she was pushed down into that cot. And she's crying. She was upset.
Was she being grabbed by the arms at some point too as well?
Yeah, and then also, pulled out by her I couldn't tell whether it was the midsection or her legs when she pulls her all the way down to the bottom, and then her head strikes the cot.
And if I could, behind you, we have it's been admitted earlier as, I believe, Exhibit 3, I believe. So it's not the exact cot, but it's the exact type of cot from the daycare.
Yeah.
Is that, if you could just please look at that. Have you had a chance to see it before?
Not this particular one, but yes,
Okay.
I've seen cots like this before with my
Okay.
kids.
And after you reviewed this video and now that you see the cot and you reviewed the CT 3D image, what is your opinion as to how that injury was sustained?
Yeah, so after reviewing the video, and if you watch the towards the very end, which appeared to be, you can't see how on a video exactly how much force is being used, but you can see probably what appears to be the most forceful time when she's pushed down. And that cot has rigid edges, metal here, hard plastic here, hard plastic through here. This is mesh. If you watch the very last time, which I think I counted, it was the 8th time when she was forced down.
I'll rewind it.
Yeah, the very last time. It was very forceful. And you can see that move a little bit, the covering on it. And I believe she hit her head, the top of her head, right here on this hard plastic when that happened. The other thing that was notable to me is she's 13 months old. You can't force a 13-month-old to take a nap. You can't force them to be still. They're gonna eventually fall asleep. But after that last incident, she doesn't move at all.
What is your opinion about that?
I was very concerned that she had a concussion when that happened, because through that whole couple of minutes, she's crying, she's popping back up because she doesn't want to take a nap. She's pushed down, she gets back up. She's pushed down, she gets back up. She pushed down, she gets back up about 7 times. And on the very last one, I was very concerned that that fracture occurred from the top of her head striking up here on this hard plastic, and she doesn't move after that.
We watched that yesterday. It was approximately 35 minutes that she didn't move. What would that tell you as a doctor?
I'd be very concerned that when she struck her head that last time, that caused a concussion, that she went unconscious.
Now, in the medical records, I believe they noted there was no soft tissue swelling.
Correct.
Would that be, could you please tell the jury, would that be normal for someone that was seen 10 days later?
Yes, it most definitely can
Could you
be.
just explain why that is?
Yeah, so the swelling is not necessarily going to be permanent. You may see the swelling come up, a few hours after the event, sometimes even sooner. But the swelling's not necessarily going to last for, almost 2 weeks. It can go down very quickly in a few days.
And if the child has hair and the parents had no reason to suspect head injury,
Correct,
they might not have even noticed it. Is that right?
correct. And if you notice, she has her hair pulled up, a lot of hair up here into a little ponytail, which is where would have been where the impact was anyway, so.
Could or would the repeated 7 or 8 times that she was forced down and hit her head, could that have played a role in sustaining the skull fracture?
Possibly,
Possibly.
yeah.
Doctor, have you written any articles or anything related to head trauma in children?
Yes,
Could you please describe what those are and tell us if they were published or not?
yes. The most recent publication, I was involved in a research project at Le Bonheur with using artificial intelligence to detect retinal hemorrhages in infants with abusive head trauma. And that was published in JAMA. and then, or the Journal of the American Medical Association. And then I was involved in a project involving witness cases of abusive head trauma, where we had children that came in with findings of abusive head trauma that were actually witnessed by the mechanism was witnessed by objective observers. And then I've written a chapter for an orthopedic textbook for residents and medical students, and also primary care providers that want some extra support. And the chapter that I wrote was specifically on fractures.
Okay. Doctor, did you prepare a report regarding Olivia's case?
I did.
I'm going to pass. Is that the report that you prepared?
Yes.
Your Honor, I would ask to admit that and offer that, and mark that as the next numbered exhibit.
8. Look. You wanting that demonstrated to the jury before?
No, just that they can take it back with them later during deliberations, Your Honor. That's fine. I believe everything in it we've already covered through Dr. Lakin's testimony. So, Doctor, just to wrap up here, is the bruising that we see on Olivia's arms consistent with child abuse?
Yes.
Okay. And that's based upon what?
The pattern of injury that's seen, and also the support in seeing the mechanism on the video.
Okay. And is the skull fracture that we saw and that Olivia sustained, is that consistent with child abuse
Yes.
based upon?
Also, the mechanism that was viewed on the video, as well as the characteristics of the injury that is seen on the CT scan.
And Dr. Lakin, as an expert in child abuse pediatrics, after reviewing all the evidence in this case, what are you able to say about the injury sustained by Miss Olivia Hyde?
The injuries that I reviewed, in my opinion, are consistent with non-accidental trauma or blunt force trauma.
If I could have one moment, please, Your Honor.
You may.
So, Doctor, let me just ask you this. Was this the only CT scan that was done on Miss Olivia Hyde that you're aware of?
Yes.
So why would they have not done a follow-up CT scan to determine if that was a fracture, if it had healed or not? Is there a reason they wouldn't have done another one?
Yeah, we don't follow up linear fractures. There's no treatment for them, and you're not going to expose children to additional radiation if there's no intervention involved.
So it might have helped us in our legal case, but it has no medical necessity for the child?
No.
Right.
So all of our evaluations are directed towards medical treatment, not for court.
Thank you very much, Doctor. I have no further questions at this time.
Ladies and gentlemen, anybody, we've been going for a while before cross-examination. Anyone need a break? Right, Mr. Tryon, you're
Thank you.
free to cross-examine. Oh, sorry, did somebody raise a hand I didn't see? Got to be more aggressive. Throw something at me next time. All right, we'll take about let's take a 10-minute restroom break, and then we'll come back. We'll stand at recess for 10 minutes.
And you may not be aware of this, the indictment in this case was returned April the 4th of 2023. Your report was disclosed, I think, February 24th. Is that right?
That's correct.
Of 2023. When did you actually do your work on this case?
So I was first contacted in February of 2023. Actually, if I can look back at my
Sure.
notes, because I wrote down my first contact was let's see. Yeah, February 14th of 2023, I had a request to review the records. And then I wasn't able to see the video until March 7th of 2023.
After seeing the video, did you communicate with the district attorney's office about the charges to be included in the indictment?
We didn't talk about I don't think we talked about the charges. He asked me about my opinion about whether or not I felt like this was consistent with non-accidental trauma, and then also we discussed the fracture.
Now, Olivia Hyde was seen, I think you told the jury, by her primary care provider. That would have been January the 13th, is that right?
That's correct.
And she was presented that day for some blood work and a physical exam.
Correct.
And you've had a chance to take a look at what the Vanderbilt Pediatric Office in Hopkinsville, Kentucky concluded about that visit, is that right?
That's correct.
And that was just several days after the alleged event,
Correct.
correct? They reported that there were no changes in her eyes or pupils, correct?
Correct.
And that would have been significant to your sort of alternate diagnosis of this. Perhaps there was a concussion or something like that.
You're not going to have changes in your eyes with the concussion.
They reported a painless range of motion in her extremities, correct?
Correct.
That she did not appear to be in any distress
Correct.
whatsoever. And that all of her lab results were normal.
Correct. They only took one lab test, and that was the hematocrit.
And they didn't note anywhere that there was any swelling of her head, is that right?
That's correct.
And they didn't note that there was any tenderness reported by the parents in her head.
Not in her head. The parents reported irritability since the incident.
In fact, there was no swelling of Olivia's head that was ever reported
Correct.
or detected in this case. Is that right?
That's correct.
On January the 18th of 2023, that was the date that the police suggested that the Hydes bring Olivia to Vanderbilt. She was not sick, correct?
Correct.
She was not unconscious.
Correct.
She was not in pain.
I'm not aware of that, no.
Wouldn't you have expected signs of pain, evidence of crying in a child that had actually sustained a skull fracture?
Not 10 days after the event. And the other thing that I think is lost a lot of times is that we're talking about a 13-month-old who's non-communicative. And so children of that age, it's actually very common that we talk about the fact that we can't base our clinical findings on these children, which is why we do so many x-rays and we do CT scans, because they can't tell you that their head hurts, they can't tell you that they don't feel well. So their changes in demeanor are oftentimes missed because 13-month-olds get fussy and 13-month-olds cry, but they can't tell you why. And so I'm not surprised at all that there's no history of that, because a 13-month-old will cry intermittently. A 13-month-old, they get picky. So a lack of appetite, you don't even think twice about because they're 13 months old. The other issue is my specialty is child abuse pediatrics, and we do try to do a lot of education with other providers. So Olivia, having the history that she had in the report, obviously the primary care provider never saw the video. If the primary care provider had seen the video, I'm sure that she would have transferred her to an ER to be evaluated. But she didn't have any of that history. She didn't have that. But the reason why we're called is oftentimes because we tell a generalist, these are the things you have to do, because 13 months old, you can't base it on seeing if she's tender in her arms and legs. You don't know. So sometimes those things are, I don't want to say that they're missed, but if that's not her routine practice to examine the head, to palpate the head, especially if her hair is in a ponytail on the top of her head, she may miss it. I can't speak to that. I'm not going to say that she did. I'm just going to say what she has documented I can't speak to. But that's why we have my specialty.
And you talked about Olivia being nonverbal because of her age. For children that are nonverbal, doesn't that also complicate your sort of alternative suspicion that there might have been a concussion?
So I'm basing my concern that there may have been a concussion on my experience with infants and toddlers and my observation of what happened. When you are trying to, again, you can't force an infant or a toddler to go to sleep. They have a very characteristic way of falling asleep. She was crying and trying to get up. She's pushed down onto the cot very hard, and then she goes still or limp and doesn't move again. That's not the characteristic of a 13-month-old falling asleep.
I want to talk to you a little bit about the CT scan that was done at Monroe Carroll Hospital at Vanderbilt on January the 19th, 2023. And the finding of the radiologist was that there was a linear lucency in the skull that was suspicious for fracture. Is that right?
That's correct.
Well, that's it for today. Tomorrow is part 3, and we will continue the testimony in this case. So you all have a wonderful evening. Ciao, ciao, and ta-ta. I will see you again real soon. Just a reminder, Thursday is the 25th. There is no live stream. So there will be one tomorrow, but there won't be one on Thursday because it's Christmas Day. So with that in mind, you all have a wonderful evening.